Initially, set the humidifier heater to a medium setting of 3. Apply the mask to your face and turn on the PAP machine. Adjust the head strap to seal the mask and prevent any air leaking. If the set pressure is uncomfortable, activate the ramp feature.
What the ramp feature does is gets you there over a period of minutes at a much lower pressure, so you can most likely fall asleep breathing relatively normally before the real pressure kicks in.
You may need to adjust your sleeping position to allow the mask to rest comfortably on your face without leaking. You may need to readjust your straps after positioning yourself. Your sleep apnea symptoms should be controlled by your PAP therapy, depending on how many hours you sleep with the mask on your face. When you're new to the therapy and are able to tolerate it for several hours, you may not notice a significant change in your symptoms. As you work towards using the PAP all night, you should notice improvements in how you feel. As you increase your PAP machine usage, you may experience the following positive improvements: less snoring, sleeping more restfully, waking up more refreshed, having less daytime fatigue, and a higher energy level. It is important for you to know how to correct the most common problems you face with PAP therapy. Waking with a dry mouth or nose is corrected by increasing your humidifier heater setting and checking to be sure that your mask is not leaking.
Listen for the leaking. You'll hear the psst. You shouldn't be hearing that sound.
Mask leaking can usually be corrected by adjusting the head straps. If you develop a tender spot or redness on the bridge of your nose due to the pressure of your PAP mask, you can usually adjust the head straps to correct the problem. However, if you notice any abrasion, skin tear, or blister on the bridge of your nose, it is very important to stop the therapy and contact your respiratory therapist. They may be able to provide a gel cushion to help protect the area, or occasionally the mask will need to be replaced.
Your PAP disposable supplies should be replaced on a regular basis. Mask cushions can break down over time, causing them to leak. Tubing and humidifiers can collect moisture, and it is possible for bacterial contamination to occur. Each insurance provider has guidelines when they will reimburse for replacement supplies. Your respiratory therapist will provide you with a list of when supplies can typically be replaced. Your respiratory therapist will monitor your PAP usage over your first 3 months of service. This information will be provided to your doctor to help with assessing your progress. Your insurance company may use this information to determine coverage. The current guidelines being used for this purpose require you to use the PAP for 30 consecutive nights for at least 4 hours each night. You will need to meet these guidelines within 3 months of receiving your machine. If you do not meet your insurance provider's usage requirements, they may elect not to cover the cost of your PAP. The cost of paying for the equipment would then become your responsibility.
Using your PAP therapy will help you feel better overall, improve the quality of your life, and keep you healthy.
Once I became acclimated to the CPAP, it was a whole different world. I know that I would never want to go a night without sleeping with it.
Knowing that I'm getting a more full night's sleep with fewer of those wakings has increased the energy level, and I just feel better.
Remember, you're not alone when it comes to the diagnosis of sleep apnea, nor are you the only one on PAP therapy. This is a lifestyle change and can take some time getting used to it.
You just have to keep saying to yourself, I know I'm doing the best thing for me, and make it almost part of your life. It will just make it so much easier to adjust to it.
We are working together as a team to help you use your PAP therapy whenever you're sleeping so that you wake up feeling refreshed, energetic, ready to start the day, but also keeping you healthy down the road.
Hello, it's me.